بسم الله الرحمن الرحيم. ودي بناتي, we want to talk about the pathology affecting the respiratory system. As you know, every system in the body is important, but this important is differing from one system to another system. The most important system is respiratory system. ولذلك لما يجيكم واحد بالطوارئ for any condition, when he is seriously ill, we beginning with ABC. A اللي هو airway, B اللي هو breathing. A و B were related to the respiratory system. To understand the pathology system, it is very, very important to know simple anatomy and simple physiology about the respiratory system. Any system you want to know the pathology that affecting this system, you should know simple anatomy and simple physiology of that system. Then, simple anatomy of respiratory system. Thoracic inlet, anatomically speaking, thoracic inlet divided the respiratory system into two parts. In the upper airway, اللي هو beginning from the nose to the thoracic inlet, and lower airway. The upper airway usually becoming narrowing during inspiration, which is usually, this is visible below 4 years. Above 4 years, because the cartilage becoming so strong, هذا narrowing will be negligible. يصير كلش قليل مو كلش واضح. But usually before 4 years, this narrowing during inspiration will be obvious. And any disturbance of airflow in this part will produce sound, we call it stridor. بالضبط ولدي بناتي، فالساوند كبيرة واحد ينفخ بها من يقلل الدايمتر، من يسوي obstruction يقلل الدايمتر يطلع له صوت. هذا الصوت سموه stridor. إذن stridor هو due to the narrowing of the upper airway, which is usually occurring during inspiration. ليش؟ لأنه بالinspiration هو أكو narrowing، وبالinspiration يصير بيه narrowing أكثر بعد يطلع الساوند. بالexpiration ما يبين إلا إذا unless there is severe obstruction. إذن in severe obstruction this will produce inspiratory and expiratory stridor. إذا mild or moderate obstruction will produce inspiratory stridor. Lower airway, bronchus bronchioles, usually the diameter of this part of the respiratory system become narrow during expiration. And any disturbance of the flow of the air in this part will produce sound, we call it wheeze. من أخلي سوندا صغيرة وأنفخ بيها وأقلل الدايمتر تطلع لي ساوند. الصافورة اللي نصافر بيها تطلع لي ساوند، هذا الساوند سموه ويز. إذا السوندا الكبيرة سوت لي ساوند سموه سترايدر، السوندا الصغيرة سموه ويز. Usually wheeze occurring during expiration، لأنه بالexpiration يصير narrowing physiologically speaking. إذا أكو pathological narrowing راح يسوي لي wheeze. During inspiration this wheeze will disappear if the obstruction is moderate. إذا obstruction is severe will produce inspiratory and expiratory wheeze. وإذا obstruction is so severe will not produce any flow of the air, will produce silent chest. Physiologically speaking, we can divide the respiratory system into two parts. البارت الأول اللي هو look like a tube. خلوا بالكم respiratory system عبارة عن tube conducted the air from the atmosphere to the body. The first part هو عبارة عن tube. This connects the air from the atmosphere and make it suitable for exchange transfusion. يعني يسوي له humidification، يسوي له cleaning of this air بس هو عبارة عن 80% of the function of this part. هاي التيوب 80% من شغلها هو conducted the air from the atmosphere to the alveoli يوصل لي الهواء أو الأكسجين من الأتموسفير يوصله للألفيولاي. الألفيولاي اللي هو second part this is responsible for exchange of the 80% of its function هو gas exchange. يدخل الأكسجين ويطلع لي CO2. And there is some defense mechanism. طبعا there is some defense mechanism to protect this part of the respiratory system. A very important point to understand any disease of respiratory system. You should put in your mind, physiologically speaking, carbon dioxide diffuse 20 times more than oxygen. يعني diffusion مال CO2 is more easy than diffusion of oxygen. ولذلك any disease affecting the respiratory system, first of all there will be hypoxia. Later on there will be hypercapnia. لأنه the diffusion مال CO2 is more than diffusion of oxygen. يعني there is severe disease that will leading to the affection of the diffusing of the CO2. Then, in any disease affecting the respiratory system, first of all there will be hypoxia. Later on there will be hypercapnia. يعني لو واحد يسألكم يقولكم this patient presented to you with hypercapnia, it meaning the condition is so severe that leading to the hypercapnia. هسه نجي على the disease that will affecting the upper airway. احنا قلنا ال upper airway اللي هو from the nose to the thoracic inlet هو عبارة عن tube. What are the disease؟ يعني 80% of the function of this part is to conduct the air to the lower airway. فإذا هو major pathology that will affecting this part is obstruction. Echo disturbance of other function of defense mechanism of this function is cilia disturbance اللي هو removing of particle or any foreign bodies, small foreign bodies from the respiratory system. هذا minor function. Like the most important pathology, major pathology affecting the upper airway is obstruction. This obstruction could be infectious, could be non-infectious. Infectious and due to the organism, due to the microorganism. Non-infectious due to the non-organism, non-pathological organism. And non-infectious may be congenital, any congenital anomalies that will affecting the upper airway leading to the obstruction. Or acquired مثل inhaled of steam بخار ما يصير بinhalation وصار scarring of the upper airway يصير narrowing. foreign body هم يسوي لي narrowing of the upper airway. Tumor non-infectious or mass from the upper from the adjacent organism or adjacent organ. This what we call it non-infectious. هسه نجي على الcongenital. As you know, in pediatric age group, usually congenital anomalies manifested in this age group. One of the most important congenital anomalies that will affecting a human being during neonatal period is choanal atresia. choanal atresia فتحة الأنف الداخلية اللي هو connected the nose to the pharynx. They found that this is a common congenital anomalies. الانسيدنس مالتها 1 in 7,000 live birth. Usually this is a common in female to male is 2 to 1. There is septum between the nose and the pharynx. قلنا هاي السبتم اللي تحجز لي النوز from the pharynx. About 90% of these symptoms composed of bone, and 10% is a membrane. 10% is a membrane or combination of both membrane and bone. 50 to 70% have another congenital anomalies. شوفوا ولدي بناتي، خلوا بالكم. Any neonate presented to you with congenital anomalies, whatever the congenital anomalies affecting any system, respiratory system, cardiovascular system, you should search for the other congenital anomalies. You should search for the another congenital anomalies. لأنه there is possibility of another congenital anomalies associated with this congenital anomalies. For example, choanal atresia. من قال لي واحد choanal atresia أبقى أدور على ال other congenital anomalies. They found that 50 to 70% of neonate with congenital atresia having another congenital anomalies. أكو common congenital anomalies اللي هو important one يسميها charge. Charge C اللي هو coloboma of the eye. H اللي هو heart disease, any congenital heart disease. A choanal atresia. R اللي هو retardation يعني psychomotor retardation. psychomotor retardation. G اللي هو genital abnormalities اللي هو ممكن يكون ambiguous genitalia يعني it not look like female or male. And there is E اللي هو ear anomalies. This is occurring in 10 to 20%. 10 to 20% have charge اللي هو a combined of another congenital anomalies. نخلي ببالنا دائما من يصير congenital anomalies أكثر system affected other than charge. أكثر system affected with congenital anomalies اللي هو renal system. خلوها بالكم دائما من يجيني واحد congenital anomalies أخلي بالي renal system. You should investigate renal system. هذا الchoanal atresia could be bilateral or could be unilateral. شافوا ذول congenital anomalies usually it is common in bilateral. Clinical manifestation. The clinical manifestation راح differing from one infant to another. هسه بعدين نحكي ليش from one infant to another. هسه نجي على unilateral والbilateral. In unilateral usually it is asymptomatic until there is respiratory infection. صار عنده flu-like illness. He is improving from flu-like illness. He is improving from influenza, but still there is unilateral nasal discharge. تجي الأم تقول له دكتور هذا كان influenza. شو الحمد لله صار زين. بس still there is nasal discharge. Unilateral nasal discharge. You should put in your mind choanal atresia. You should investigate for choanal atresia. إذن unilateral is asymptomatic unless there is respiratory tract infection. After improving, there is usually unilateral nasal discharge. الbilateral هنا differing from an infant to infant. النيونيت عموما 80% of neonate نسميها obligatory nose breather. ما يقدر يتنفس إلا من خشمه. يعني مو هسه أي واحد منكم بدي بناتي من يصير عنده nasal obstruction يفتح حلقه ويتنفس. النيونيت ذول ال 80% of neonate cannot open his mouth or her mouth to breathe from his mouth. He is obligatory nose breather. زين إذا كانت like unilateral إذا راح يصير عنده cyanosis راح يصير عنده hypoxia. هذا الهايبوكسيا will leading to the agitation and leading to the crying. من بدأ crying فتح حلقه. من فتح حلقه this will improve cyanosis. إذن any cyanosis بالneonatal period relieved by crying نخلي بينه bilateral choanal atresia bilateral choanal atresia. اكو قسم من النيونات، احنا مو قلنا الماجوريتي من النيونات هم obligatory nose breather. اكو قسم من النيونات yes he can breathing from his mouth، يفتح حلقه ويتنفس. هذا شو وقت يصير عنده cyanosis؟ يصير عنده cyanosis while he is sucking during feeding فاتح حلقه يتنفس عادي. من نخلي الفيدنج له بعد يصير عنده cyanosis. إذن البايلاترال choanal atresia يجينا بتو تايب أو cyanosis. cyanosis relieved by crying نخلينا bilateral choanal atresia. وممكن يجيني cyanosis during sucking. أنا ما يقول لك دكتور هو كل شيء ما أبين، بس من أرضعه يصير cyanosis. تخلي بالك البايلاترال choanal atresia، وهذا هو الاكسبلانيشن. قسم منعتهم obligatory nose breather، وقسم منعتهم yes he can breathe through the mouth. Diagnosis from clinical feature first of all، والsecond things inability to pass a small catheter. هذا الكاثيتر اللي هو الانجي تيوب، مريض ندخله there is inability to pass، تقريبا يدخل 3 إلى 4 سنتيمتر اللي هو النوز، توصل للسبتم that will separate the nose from the pharynx nasopharynx، تقريبا 3 إلى 4 سنتيمتر. وراها ما يدخل الكاثيتر. هذا suspicion to confirm especially when we want to send your patient for surgery to treat this neonate. نستعمل fiber optic rhinoscopy. إذا is very difficult for fiber optic rhinoscopy نسوي CT scan حتى نشوف الكومبليت anatomy، حتى يصير visualize anatomy to be clear for the surgeon to do operation complete correction of this choanal atresia. treatment قبل لا يروح للسيرجري هو عبارة عن oral airway. هاي الأورال airway اللي تشوفونها دائما يخلونها especially in neurosurgery من يجينا واحد unconscious، أو feeding nipple. هذا الديس مال ماما أفتح الفتحة كبيرة وأخليها بحلقة حتى just to make the mouth patent، أخلي الحلق مالته مفتوح while you are repairing your child or your neonate, your patient for surgery. For surgery, most important things هو correction of the defect. Transnasal through the nose يسوي لنا opening of this or removal of this septum. هذا correction surgery. لكن إذا your patient cannot tolerate this surgery يسوي له intubation or tracheotomy. If your patient cannot tolerate correction of the defect, suppose he has another congenital anomalies, for example heart anomalies, while we are waiting for the improving of his condition we do intubation نخلي له intubation tube oro tube or نخلي له tracheotomy نسوي له tracheotomy. هذا هو congenital anomalies affecting the nose. نجي على الورا النوز اللي هو larynx. كمان congenital anomalies affecting the larynx we call it laryngomalacia. It is a common congenital anomalies affecting the larynx. It is about 60% of congenital anomalies that affecting the larynx. تذكرون بالchoanal atresia قلنا من نلقى congenital anomalies نخلي ببالنا another congenital anomalies. They found that 15 to 60% of laryngomalacia have another congenital anomalies. For example tracheomalacia، يعني الماليشيا not affecting the larynx alone تمتد إلى التراكية tracheomalacia. Subglottic stenosis، vocal cord paralysis، vocal cord paralysis. تذكرون بالكوينال اتريزيا قلنا it is common in female laryngeomalacia. It is more common in male to female 2.1. It is the commonest cause of stridor, most common, and this exacerbated by crying. تدرون هو there is malacia يعني اكو ضعف بالغضاريف بار الحنجرة and there is slight obstruction. هذا الobstruction will be increased during crying, during agitation, during feeding. والله دكتور هو عنده صوت خفيف بس من يبكي الصوت مالته يصير أكثر سترايدر يصير obvious. During agitation يصير obvious. During feeding والله دكتور من رفع sound يصير obvious. This is exacerbate the stridor. طبعا الدياغنوسيس هو عبارة عن flexible laryngoscopy. طبعا الدياغنوسيس هو clinical diagnosis. إذا to confirm this 100% by flexible laryngoscopy. Treatment طبعا 15 to 20% have ذولا طبعا as you know treatment هو just reassurance. Mostly laryngomalacia is self-limiting. Just reassure your patient. They found that 15 to 20% of them had severe symptom like what? Like progressive respiratory distress. تعرفون بابا respiratory distress هو عبارة عن subcostal, intercostal, suprasternal nasal moving of nasal. هذا هو respiratory distress. Sometimes presented to you with failure to thrive. ذيك الساعة أنت مضطر تسوي tracheotomy. This is rare. Usually laryngomalacia usually is mild and there is no need for treatment. Just reassure the family. This is simple things. Usually it is improved by itself. طبعا هو مثل ما قلنا هو عبارة عن observation. Tracheotomy as an emergency to relieve respiratory distress. After that we do endoscopic supraglottoplasty to complete removal of or decreasing this. other things هسه هذا احنا خلصنا congenital anomalies that will affecting common congenital anomalies that will affecting the upper airway. قلنا upper airway affecting يعني what are the pathology in the upper airway? الباثولوجي is obstruction. قلنا ممكن يكون congenital ممكن يكون acquired والacquired ممكن يكون infectious due to the pathological organism. أكو عندنا laryngeotracheobronchitis or we call it CRU. It is a viral disease. يعني ما يصير واحد ولدي يسألكم laryngeotracheobronchitis CRU what are the cause يقول bacteria. This is a viral disease rarely caused by mycoplasma. The upper airway usually affecting by the common virus that will affecting upper airway هو para-influenza virus اللي هو طبعا type 1 و 2 و 3. شوفوا ولدي بنات بالنسبة للفيروسز every virus has predilection to systems. مثلا الهيباتيتس الليفر أكو عنده هيباتيتس A و B و C and so on. مثلا GIT الروتافيروس. respiratory system ذول الفيروسز هم مال respiratory system. They have a predilection for respiratory system. The upper airway is differing slightly from the lower airway. نصعد واحد وننزل واحد هسه بعدين تشوفون. الcommon virus that will affecting upper airway هو para influenza virus type 1 2 3. It is account for approximately 75% of cases. يعني واحد من يسأله هذا شنو هذا كرو laryngeotracheobronchitis. What are the causes? The viral causes. The most common virus, yes, is para-influenza virus. وبعدين نجي نعدد influenza virus A and B, respiratory syncytial virus, measles virus, وadenovirus. طبعا respiratory syncytial virus من راح نروح lower airway هو يصعد لي فوق، هو يصير أول فيروس. إذن upper airway the most common virus that will affecting upper airway هو para-influenza virus. The common virus that will affecting the lower airway هو respiratory syncytial virus. هذا بالنسبة للإنسيدنس. تبقى serious one. The serious one is adenovirus. Adenovirus is a serious one because there is a lot of complication that will affecting the human being who is invaded by adenovirus. يعني بنقول the common virus is para-influenza virus. Serious virus that will cause a lot of complication اللي هو adenovirus اللي هو virus. Clinical manifestation usually طبعا هو عمره usually laryngeotracheobronchitis. Usually there is history in the family of the flu-like illness or upper respiratory tract infection. Later on, this infant getting upper respiratory tract infection. والله دكتور هو كان عنده flu-like illness for 1 to 3 days. وبعدين later on he developing mild barking cough. والله دكتور بعدين صارت بقحة بها بحة. هاي القحة بها بحة هي اللي تخلي الأمية تجيك as a doctor. Later on he developing stridor. الدكتور قال يطلع صوت. طبعا as you know stridor usually occurring during inspiration. Inspiration as we said before, because during inspiration physiologically there is narrowing of the upper airway. First of all, this will appear stridor during inspiration. If it is occurring during expiration, it meaning the condition is severe. When the condition is severe, sometimes associated with respiratory distress, اللي قلناها subcostal, intercostal, suprasternal, moving of air nasal, and hypoxia, as we say before. The first gases will be affected in the pathology that will affecting the respiratory system is hypoxia. Hypercapnia, later on cyanosis. Sometimes patient presented to you cyanosis. Usually the temperature slightly elevated. In case the temperature ممكن تكون normal, ممكن slightly elevated. Rarely, sometime reaching 39 to 40 centigrade. As you know, this is a viral infection. Usually it is associated with mild elevated in the temperature. طبعا the duration of the illness from several days and rarely reaching several weeks. لما يتصلك دكتور يعني هذا من راح يستلزم ممكن ترجع له. Yes, there is possibility of recurrence, especially when your patient presented to you between the age of 3 and 6 years of age. إذا عمره 3 4 5 6 تقول له ترى ممكن هذا يرجع له. They found that 15% of these patients have strong family history of croup. أخوه الأكبر منهم كان عنده أي والله كان دكتور. حمامة خوالة كانوا عندهم أي والله كانوا عندهم. أكو strong family history. طبعا examination it is keep this in your mind. It is contraindicated to manipulate the pharynx. ما يصير تستخدم tongue depressor especially in severe cases. ليش؟ لأنه in severe cases sometimes it is very difficult to differentiate between groups اللي هو laryngeotracheomalacia and epiglottitis. And if you expose the pharynx by the tongue depressor, this will leading to the complete obstruction and death of your patient. It is contraindicated. In this X-ray, yes, X-ray examination, AB posterior anterior view, يصير عندنا stipple sign يعني gradual decreasing in the diameter of the larynx الاير اللي موجود باللارynx نشوفه decreasing in diameter, slightly decreasing in diameter, نسميها stipple sign. طبعا as you know, most cases of laryngeotracheal bronchitis or croup usually diagnosed by clinical diagnosis. A clinical diagnosis, if you are seeing some patient of presented to you with laryngeotracheal bronchitis, you will not forget it. It's very easy to diagnose laryngeotracheal bronchitis. Is there an indication? And as we said before, this is usually a mild disease. There is no need to admit your patient inside the hospital unless there is, first of all, actual or suspected epiglottitis. والله هذا شو كنا epiglottitis. You should admit him inside the hospital. إذا there is progressive stridor or severe stridor at rest وهو قاعد يصير عنده stridor. إذا أكو sign of respiratory distress اللي قلنا عليها، إذا أكو hypoxia، إذا أكو cyanosis، يعني your patient is toxic. Depressed sensorium. There is poor oral intake. يعني he's seriously ill. He's toxic. This patient you should admit inside the hospital. Otherwise, there is no need to admit your patient inside the hospital. treatment هو عبارة عن cold steam in mild cases. نفس هذا النبيولايزر اللي نستخدم بالأسماء، ومو كان ما نخليها بيتا أجنست، نخلي بها فد بيس اوف ايس، نجيب ثلج ونخليه بمكانه. هذا الكولد ستيم طبعا as you know cold, this will lead to the vasoconstriction. Vasoconstriction will decreasing the edema, decreasing the mucus، يعني decreasing the obstruction. أو nebulized racemic epinephrine نخلي 0.25 to 0.5 مليلتر، يعني أما نص سيسي أو ربع سيسي. الكونسنتريشن مال الإبنفرين اللي يستخدمه هو 2.25%، نخليه ب3 مليلتر of normal saline، يعني ناخذ أما نص سيسي أو ربع سيسي from epinephrine ونخلي وياه 3 سيسي of normal saline ونخليه بالنبيولايزر for 20 minutes. مرات نخلي steroid aerosol بالنبيولايزر steroid aerosol. أو in severe cases ممكن نستخدم systemic steroid either injectable or oral. الدوز مالته البرينيزولون 1 to 2 ملغ per kg per 24 hour. ممكن يصير عندي complication. ممكن. The complication found that 15% of patients with laryngeotracheal bronchitis have complication. ممكن هذا الانفكشن يصعد لي فوق يسوي لي otitis media. ممكن ينزل لي جوا يسوي لي bacterial، ممكن secondary bacterial infection يسوي لي bacterial tracheitis which is a serious disease. ممكن ينزل لي جوا يسوي لي interstitial pneumonia. ممكن يسوي لي bronchopneumonia. ممكن هاي البرونكونيمونيا ممكن يسوي لي نيموميدياستينم or pneumothorax. This is a complication of laryngeal bronchitis. Other disease or other pathology that affecting the upper airway اللي هو acute infectious laryngitis. بس اللارynx is affected. it is a viral disease look like laryngeotracheobronchitis except for diphtheria. يعني 90% هو viral disease. أكو 10% due to the diphtheria. طبعا diphtheria nowadays because of vaccination and their level of vaccination is a rare disease. Clinical manifestation look like there is upper respiratory tract infection. أكو بالفاميلي flu like illness وبعدين صار عنده upper respiratory tract infection اللي هو flu like illness. بعدين صار عنده sore throat. دكتور من يبلع شوية يتأذى. صار عنده كف. لكن characteristic things بالinfectious laryngitis hoarseness of voice or loss of voice والله ما يقدر يحكي. هذا اللي يفرقنا الacute infectious laryngitis from laryngeotracheobronchitis. Yes, there is possibility of respiratory distress. As you know, if the disease is severe, yes, can cause respiratory distress. طبعا usually this is also a clinical diagnosis. Rarely we need to laryngoscopy to confirm the diagnosis to see the edema of vocal cord and subglottic tissue التريتمنت هو the same. Treatment the same. Look like laryngeotracheobronchitis. أكو entity we call it acute spasmodic laryngitis or spasmodic croup. This is occurring in 1 to 3 years. There is no history of viral infection. تجي الأمين الدكتور ما حد منشور بالعائلة. هو هم كان منشور. Suddenly he developed croup. Suddenly he developed سترايدر. هو نايم وقعد بالليل. There is sudden onset of barking cough. القحة بها بحة. Noisy inspiration. In severe cases there will be respiratory distress. This is usually due to the allergy. It is not caused by infectious cause. Usually the patient is afebrile. ما عنده شيء. afebrile. طبعا ممكن يصير recurrence. Yes, ممكن يصير recurrence. شوف التريتمنت look like slightly differing look like laryngeotracheobronchitis. نعطي epinephrine الكونسنتريشن مالته 1/1000.1 milliliter per kg intramuscular or racemic epinephrine بالنبيولايزر look like laryngeotracheobronchitis. أو نستخدم البريدنيزولون 1 to 2 milligram per kg per 24 hour for 3 to 5 days. Echo entity is very important. اللي هو acute epiglottitis. This is very important. A serious disease affecting human being. This is a potentially lethal disease. This is occurring in the age group 2 to 7 years. The peak incidence 3.5 year. تذكرون ولدي بناتي ذولاك كل causative organisms viral. Acute epiglottitis is bacterial cause. إذن acute epiglottitis caused by bacteria اللي هو Haemophilus influenza type B. بالبلدان اللي بيها صار famous for prolonged period using of hip vaccine اللي هو vaccine against Haemophilus influenza شافوا there is decreased incidence of acute epiglottitis. شافوا rare cases of acute epiglottitis caused by another bacteria like staphylococcal bacteria or streptococcal bacteria. لكن المهم بالنسبة لنا الواحد يسألنا يقول this is acute epiglottitis. What are the causes? It's a bacterial disease caused by Haemophilus influenza type B. طبعا Haemophilus influenza type B because it causes acute epiglottitis, which is a serious disease, and it causes meningitis, which is a serious disease. ولذلك سووا لها vaccine. هنا also there is no family history. دكتور ماكو واحد بالبيت عنده influenza or respiratory symptom. Suddenly he developed barking. Suddenly he developed respiratory distress. اللحة مالته rarely there is barking cough. Rarely there is barking cough. The respiratory distress رأسا first manifestation. طبعا this disease is rapidly progressive. دكتور الصبح كش ما بي شو ورا ساعتين ثلاثة high fever ورا ساعتين ثلاثة sore throat. It's difficult for swallowing لأنه severe obstruction leading drooling of saliva. leading of saliva كانت تطلع منا. طبعا تدرون ولدي بناتي السليفري gland every day will produce 2 to 3 liters. هذا كله احنا ما نحس بيه، تروح للفارنكس للستومك للانتستين ويصير بيه absorption. لكن لأنه severe obstruction this will lead to drooling of saliva. السلايفا تطلع من حنقه ما يقدر يبلعها. البريثنج is labor بالقوة ياخذ النفس مالته. he make his neck is hyper extended حتى هاي الصوت ده ما تنعوج، حتى يفتح التنفس مالته يقعد in sitting position ويخلي يده supporting his neck in hyper extended اللي نسميها tripod position. air hunger restlessness يعني respiratory distress syndrome, sometimes getting cyanosis and coma. If you are not treating your patient there will be complete obstruction and death. نخلي ببالنا هنا الست رايدر is rare والباركينج كف is rare لأن الobstruction is so severe. الانفستيجيشن هناك بالنارنجيوتريكيوبرونكايتس نسوي له posterior anterior، هنا نسوي له lateral view يصير عندنا thumb sign، يعني كأنما أنت مخلي إيدك خلي الإصبع مالتك الإبهام مالتك على اللارنكس ويشوف الاير بالاكس راي هو كأنما مثل الثم موجودة هناك، نسميها thumb sign. direct visualization طبعا should be done if you want to visualize the epiglottis. تسوي diagnosis لازم نشوف الإبيجلوتس شلون نشوفها بالتنج depressor. You should do this inside the operating room with the preparation for immediate tracheotomy. تروح لابو الإيانتي تجيبه وياك تقول له يابا أنا شكيت هذا إبيجلوتايتس، تدخلونه للثياتر وتغسلون وترتبون أموركم كأنما راح تشتغلون عملية endotracheal or tubation or tracheotomy. ذيك الساعة تشوف الإبيجلوتس. If you confirm this your patient should be quiet. دير بالك عليه لأنه any agitation this will leading to the complete obstruction. The first important things for treating epiglottitis اللي هو nasotracheal intubation or tracheostomy. أول ما شخصت epiglottitis هسه هو mild هسه هو moderate هسه هو severe لازم tracheostomy، لازم endotracheal tube or tracheostomy وتخلي هذا tracheostomy for 2 to 3 days وتبدأ treatment اللي هو cefotaxime third generation cephalosporin 100 mg per kg per day every 12 or 8 hours or ceftriaxone 50 to 75 mg per kg per day or بيرونيم 60 to 120 mg per kg per day. The duration هو 7 to 10 days. إذن هذا البيشنت وأخوته وأمه وأبوه ذولا you should have prophylaxis rifampicin 20 mg per kg الماكسيموم الأبر دوز اللي هو 600 mg for all household contact for 4 days لمدة 4 أيام كلهم لازم ياخذون ريفامبيسين for 4 days. هسه لو نجي على الديفرنشال دايجنوسيس من أقول ديفرنشال دايجنوسيس ولدي بناتي يعني مال الكل مثلا لما أقول what are the differential diagnosis of a croup تعددوا لي ذني what are the differential diagnosis of epiglottitis تعددوا لي ذني what are the differential diagnosis of spasmodic croup تعددوا لي ذني يعني differential diagnosis of stridor ممكن يكون infectious cause like bacterial tracheitis, diphtheria, infectious mononucleosis, measles, retropharyngeal or peritonsillar abscess. تذكرون من قلنا ممكن يكون mass outside the larynx or outside the upper airway that will lead to the narrowing and causing stridor. angioedema ممكن aspiration of foreign body تذكرون ودي بناتي من قلنا ممكن يكون non-organic laryngeal lobe vascular ring واحدة من congenital anomalies of affecting laryngeal lobe of upper airway والvascular ring congenital anomalies affecting the cardiovascular system laryngeal papilloma subglottic hemangioma trauma or tumor metabolic hypocalcemic tetany tetany leading to the spasm of the muscle will leading to the narrowing of the larynx and causing stridor. Vocal cord paralysis either by hydrocephalus, cerebral palsy